Hi everyone, in this video we are going to discuss about incident report. I am Julian K. Thomas, faculty working in Triple M College of Nursing. The objectives include the group should be able to define incident reporting, enlist the purpose of incident reporting, list down the types of incidents and describe the characteristics of a good report and enumerate how to do an incident reporting. What is an incident? Incident is an unplanned event within the scope of the procedure that causes or has the potential to cause an injury or an illness and damage to equipment, building, plant, or the natural environment. In a healthcare facility such as hospital or a nursing home or assisted living, an incident report or accident report is a form which is filled out in order to record the details of an unusual event that occurs at the particular facility, such as an injury to a patient. The purpose of the incident report is to document the exact details of the occurrence while they are fresh in the minds of those who witnessed the event. This information may be useful in future when dealing with liability issues stemming from the incident. Purpose of incident reporting. Why we need to report an incident? To document the exact details of the occurrence while they are fresh in the minds of those who witnessed the event. This information may be useful in future when dealing with liability issues stemming from the incident. To take a corrective and preventive actions to find out the root cause or what is the reason for the incident, to prevent such as an incident in future by providing proper training. Types of incident. There are mainly four types of incident, which includes near miss, no harm, adverse events, and sentinel events. The first type of incident is near miss. This is where the incident did not result in harm, loss, or damage, but could have. This is referred to as a near miss. This may be clinical or non-clinical. Near miss reporting is just as important in highlighting the weakness in systems, policies, procedures, and practices. If near misses are reported and learned from and any necessary corrective actions taken, they can help to prevent actual incidents of harm, loss, or damage from occurring. Example, sometimes a medication is prescribed without considering the patient allergy or potential for significant drug interaction. The medication has been administered to the patient, but nothing happened to the patient. But it is an error which shows that we have not assessed the allergy status of the patient. Or otherwise, another example is fungus in the IV bottle detected just in a time. Nothing happened to the patients, but there is a fungus in the IV bottle that the nurse has just missed it. Okay, so this type of incidents are known as near miss. A near miss should be reported within 24 hours of working days. The second one is no harm. No harm incidents includes the incident occurred and the patient was exposed to it, but there is no harm resulted from that particular procedure. For example, a blood transfusion has been given to a wrong patient, but the patient was unharmed because the blood was compatible for that patient. A medication error happened to a patient, but there is no harm to the patient. Or a sudden equipment failure, but there is no damage has been happened. So that is known as no harm. Adverse events. The adverse incident or events can be either clinical or non-clinical. The adverse incident clinical includes an event or circumstances arising during clinical care of a patient that could have or did lead to unintended or unexpected harm to the patients. So while we are giving care to the patients or when we are at the clinical area, which can lead to some unintended or unexpected harm to the patient. So such type of events are known as adverse events in the clinical setting. Adverse incident non-clinical, an adverse event or circumstance that could have or did cause unexpected or unwanted harm, loss or damage to any individuals including patients but not related to clinical care staff visitors or damage or loss of property or premises in the hospital. So such type of incidents are known as non-clinical. So this type of adverse event should be reported within 2 hours. The examples of adverse events include housekeeping staff washing the floor. They forgot to leave the warning signs, so the patient slips and falls. Or dietary staffs provides full diet meal to a patient on clear fluids. And another example is patient is in isolation, proper signage board or is not posted on the door so that the housekeepers enters the room without proper attire or the precautionary measures. Theft of patients or hospital's properties, slip, trip, fall causing minor injuries, plaster falling on the patient which causing minor injury. So these are some of the examples of adverse events either clinical or non-clinical. The last type include the sentinel events. Sentinel events is an unexpected incident related to a system or process deficiencies which lead to death or major and enduring loss of function for a recipient of healthcare services. When a patient is admitted to the hospital, due to the error which is happening in the hospital, either the patient will lose their life or some major damage to the body parts. So such type of events are known as sentinel events. For example, medication error causing death or severe complications, wrong site, wrong patient, wrong surgery, instrument or sponge which is left in the surgical site by mistake which can lead to complications, plaster falling on the head which can cause to death of the patient. So these are some of the sentinel events or the adverse events which can lead to death or damage to the patient health. Incident category. So when we are working in a hospital setting, these are some of the areas where usually the incidents will be reported. Medication error, transcription error, distribution error, needle prick, prescription error, administration error, and fall risk. So before writing an incident report, we should know what are some of the characteristics of a good report. So the characteristics of a good report include it should be accurate and specific. So what is actually happened there, it should be correctly entered into the incident report. Factual, it should be truthful, objective, clear, it should be complete, concise, well organized, grammatically correct, and light on abbreviations. We should not use jargon words when we are writing an incident report. So it should be light on abbreviations. When an incident happens, when to report? So according to healthcare guidelines, the report must be filled out as soon as possible following the incident, but after the situation has been stabilized. So if an incident has been happened in a particular ward, first we should make sure that the incident or the patient is settled. So as early as possible, we should fill the incident form because before it goes from our memory, we should be filled into the incident report. So this way the details written in the report are as accurate as possible. The most incident reports that are written involve accidents with patients such as patient falls, but most facilities will also document an incident in which a staff member or visitor is also injured. So a incident report, it is based upon the hospital policies to whom we should write for the incident. How to report an incident? What are the steps we have to follow when writing an incident report? So the first step is to obtain an incident report form, write your name, select the incident category. It will come under which category, whether it is a medication error or it is a prescription error or it will come under a fall risk. So select the incident category, then select the incident type. What type of incident happened? Write and date Write the date and time of the incident, write in detail about the incident and submit to the concerned person. So this is the step which is included in the writing of an incident report. So how to report an incident? So obtain the proper forms from the institution. So each institutions will have their own way of reporting the incident. So it based upon the hospital policies. So each institutions have different protocol in place for dealing with an incident and filing a report. Start the report as soon as possible. Write it in the same day as the incident if possible, because if we wait for 2 or 3 days, it will go from our memory. So you should write down the basic fact you need to remember as soon as the incident occurs. So immediately the incident happens, you can write it down in a small notes whatever the incident has been happened in the ward. So it will not go from your memory, and your report write up should be within the first 24 hours after the occurrence of the incidents. So always provide the basic facts. So what is actually happened in the particular scenario, that should be entered into the incident report. So your form may have blanks for you to fill out with information about the incident. If not, start the report with a sentence clearly stating the following informations given in the incidents form. So write the first person narrative telling what happened, so that for your report, write a detailed chronological narrative of exactly what happened when you report the scene. So if you have witnessed the scene, what happened first, then second what happened, then third what happened. So it should be in a chronological narrative order what happened in the particular scene. So use the full names of each person who is included in the report and start new paragraph to describe each person's action separately. Be thorough, write as much as you can remember. The more details, better clarity will be there. Do not leave room for people reading the report to interpret something or to add something else more what they want in their way. So if you have witnessed the incident, you should write it clearly and you should not show this incident report to anyone. So don't worry about your report being too long or too wordy. The important thing is to report the complete incident. It should be the correct picture of what the incident happened in the particular ward. Whenever you are writing an incident, be accurate. Do not write something in the report that you are not sure about or you are not actually aware about what is happened. Be clear. Don't use flowery, confusing language to describe what occurred. So, whatever you have witnessed, that should be there in the incident report. Be honest. Don't write cooked up stories while you are writing some incidents. Submit your incident report. Find out the name of the person or department to whom your report must be sent. When possible, submit an incident report in person and make yourself available to answer or to clarify the questions which is asked by the higher authority. So always the incident report should be submitted by the person who has been witnessed or who has written that incident report. The person who is responsible for the immediate management of the incident, for example, the nurse in charge of the ward at the time of the incident, should make sure that immediate assessment of the situation has been done in order to determine any immediate treatment or ongoing care is needed for the patient, how to settle the patient immediately, and how much extent is the loss or damage to the property or to the patient, or what is the actual incident happened in that area. So the situation or scene should be made safe immediately. So once the incident has been happened and the report has been submitted, it is very important to identify the root cause analysis. So root cause analysis is a structured investigation process that aims to assist in identification or root of the underlying causes of a particular event or problem by determining why the failure has occurred and the actions necessary to prevent or minimize the risk of reoccurrence. So what was the incident happened, why this incident has happened, or why this mistake has happened in the particular what, or why there is a failure. So this root cause analysis will helps to identify the reason for the failure and to rectify it for that it should not occur in the next time. So a root cause is a failure in a process that if eliminated would prevent an adverse incident occurring. So training for the relevant staff on incident grading or investigations and root cause analysis will be provided as part of risk management training program. So whenever we train other nurses, we can take this as an incident and we can teach them so that there will not be any reoccurrence of the particular incident in future. So always we should have a fair blame culture in the hospital. So in an organization as large and complex as the hospital, things will sometimes go wrong. So the wrong assessment should not be one of blame and retributions, but of learning to drive to reduce risk for future patients and staff. So blame cannot and should not be attributed to individuals, healthcare professional. Identifying and addressing the dysfunctional system, that is therefore the key to reduce a risk of harm for many patients and staff through incident form. So to conclude, incidents are certain events which can happen at the hospital settings. We cannot avoid incidents completely in an hospital settings, but we should understand that always we should have a fair blame culture, that we should not blame anybody. At the same time, the management approach should be to identify what went wrong and what we need to do to avoid these mistakes in the future. So it is understood that the fear of disciplinary actions and subsequent sanctions may discourage the staff from reporting the incident. So that should not happen. Always it should be a fair blame culture. So continues to be developed within the culture of fair blame. So the management approach following incidents will be therefore to focus on what went wrong and not who went wrong. Thank you.